In hand surgery, there are so many different ways to treat the same problem. Each patient comes with their own story, their own circumstances, and their own experiences, and it's my job as your surgeon to match the surgical treatment with your goals. As hand surgeons, we see all sorts of conditions, from the shoulder down to the fingertips. Some of the most common things we see are carpal tunnel syndrome and trigger finger. We also treat broken bones, torn tendons, and some degenerative conditions like arthritis of the thumb or the wrist. We treat a lot of non-operative conditions. We also treat some that do need surgery. There are things like a broken bone or a broken tendon. We're quite literally fixing two things together that are broken. We also have nerve compressions like carpal tunnel surgery, where we're releasing the tight bands over top of those nerves to allow them to work better again. We also have reconstructive surgeries, which can be a whole wide range of things. We can replace joints. We can replace joints with metal and implants, with parts of your own body or tendons. And really part of my job is to figure out what makes the most sense for you. Patients with wrist arthritis can be treated in lots of different ways. The most advanced arthritis or end-stage arthritis can be treated with a total wrist fusion or with a wrist replacement. A wrist replacement lets them salvage whatever motion they have left, which is a game changer for their function. Hand surgery is all about precision and being delicate. With that, our technological advances have allowed us to make our incisions quite a bit smaller, but get the same amount of work done on the inside. This allows a speedier recovery and gets you back to what you're doing much, much quicker. Additionally, that means that almost all of my patients are going home from surgery the same day. One of the newer technologies that I use is my bedside ultrasound device. I can attach it to my phone or my iPad and show you real time as a patient what's happening with your body. I find that this is really helpful to help both of us get on the same page and get on the road to recovery. Another group of patients that I'm really fascinated by are amputee patients. They require longitudinal care with their prosthetists and with therapy, but over the last few years, there are now advancements in some of the surgeries that I can do as a hand surgeon to try to treat their phantom limb pain and improve their function. I've always felt that research is a really important part of my job as a surgeon. It allows us to stay up to date on the current literature and involved in the changes and trends in the way we're treating our patients. Through this, I've been able to present at national meetings, published my manuscripts in multiple of the top journals, and really been able to meet a lot of people who've been able to advance the care of orthopedics and hand surgery. Our hands are so critical to almost everything that we do, and as the hand surgeon, I get to fix that for people that are coming with really critical problems. And that's why I really love what I do.